Hi, I'm Ed Jacobs, founder of Impact Therapy, which is an active, creative, multisensory, theory-driven approach to counseling. I'm here with Heidi O'Toole, who does workshops on impact therapy and addictions and combines the two. We're going to talk about the impact therapy and creative techniques.
And how really, and what a great fit it is for the addictions field, because you activate the brain, and we know in addictions, especially the chemical addictions and even the process addictions, what you're doing is you're impairing the brain, and so that's why this is such a good fit to not just engage the clients, but then give them the opportunity to retain the information.
And two things that we say in our workshops. One is the brain likes novelty, and secondly, advertisers do what they can. Look what they do to get you to change, and counselors just try to be nice. Well, that's we want to be nice,
Absolutely.
but we do more.
But we want to be more active in our approach, because in an addictions field, if change doesn't take place, we're talking life and death. We're not talking about, not that I'm comparing it to any other mental health issue, but we do know that addiction without treatment ends up with death. So we want to engage our clients.
Yeah, we're going to just run through some of these. The use of a shield is important, especially for those that are married to or involved with someone.
Live with, grow up in alcoholic homes.
They need, when you work, those of you that are school counselors, teach your students to use a shield with their alcoholic parent or So this is an important one.
And it is, because if you just hold that shield back up, what it does is, here is the parent or the partner who's alcoholic, and their alcoholism really just attacks.
Yeah, because if you don't,
you're going to get hit,
right,
and you're going to be attacked and harmed by the addiction. So we can teach people to be able to block and know the difference between the addiction and the person.
And we show this to our clients. We do this. Why? Because the brain likes novelty.
It does.
They'll remember holding up a shield,
they do,
or the big beer box.
Or the big beer box in place, right.
Go ahead.
The other technique that I use that is really just a great metaphor for addictions is the shovel. And many times when I'm running groups, or if somebody just gets into a repetitive cycle about yes but, that's very common in addictions. Yes, but you don't understand, but you didn't have my life. And I'll just take this out of my box and I'll just start, and they'll say, what are you doing? And I say, I'm being you. And I said, you just keep digging the hole deeper. Each time you pick up, each time you relapse, it digs the hole deeper. And I say the purpose of this group or this counseling session is to get you to put the shovel down.
I may be biased, but just even watching you do that, I think I would absolutely remember that if I were a client. Don't dig myself deeper into a hole.
And each time you pick up, you're digging the hole deeper. And then I meet the client right where they are. I say, look, yes, you are in a hole. But I can promise you, if you put the shovel down, the hole won't get any deeper. So we use these props, and if you notice, we're combining them with very, very effective statements that we use in counseling. And what that does is open the door to the part of the brain that can start to make sense of what's happening in their life.
And you're challenging their irrational
Absolutely.
Ideas,
Yeah.
thinking of in REBT terms or transactional analysis, getting them out of the child seat and get them to the adult.
And getting them to edit the beliefs that really are getting them to continue to dig the hole deeper.
I use a sign,
Yeah.
somebody gave me this a long time ago, but just that chair, and I use extra chairs by putting a think sign in one chair and the little chair.
Little chair on the other chair and then addictions, then we add the beer box.
Yeah.
Right, that's what we add, the beer box.
Yeah.
Also with addictions, I say, if I may, if you don't think, okay, you're going to sink. I mean, that's just, you have to be able to think through the drink. Think.
And I know you're real good at that, of giving little jingles, which is exactly what advertisers do. They try to get you to come up with some little saying. That jingle is in your head.
Sticks in your head. It sticks in your head. Here's another thing I use with a little jingle. Staying out of this is a lot easier than getting out. And I build that up with only 1/3 of the people who get into addiction get out alive. So staying out is a heck of a lot easier okay, than getting out.
Show that where you're, and when you're in it, how difficult
And
it is
when
to
you're
move.
in it, here's people think, oh, drugs and alcohol, gambling, whatever, this lifestyle expands my world. Not really, because over here, say you're my husband, and I really want to love you and have a relationship with you. I can't get to you. What if you're my child?
You're stuck in the
I'm
box.
stuck in my addiction. What if my child needs me over there? I can't get to my child. My job. How do I get to my job in the morning when I'm hungover? So it really shows how it limits your world.
And what we do in impact therapy is and I'm right, the title of the impact therapy book is called Impact Therapy, The Courage to Counsel. Because we have the courage to do what it takes to, not that we're doing anything major.
No, we're just letting it's the truth.
But you need to have courage to confront, because when I first started and before I learned addictions counseling, I was nice to my clients. I mean, I'm not saying I'm not nice, but nice will kill alcoholics and drug addicts.
You listen and you have empathy.
And I didn't know to confront or to show this. I never got their brain engaged, and they conned me.
Right, because that's what they
studied addiction. Thank God.
Well, and the defensiveness of the addict. And this is another great creative technique that I remember that helps me focus. We get the clients to focus. We as counselors, it's imperative we focus. There's so many defense mechanisms. I use these two arrows to remind myself when working with the addictive population where to focus my energies. Because what I've been taught is the higher the defense mechanisms, the deeper the pain. And so we have to filter out the barrage of defenses, and that's what being competent is. Like you said, you study addictions, you realize, oh, that's a defense mechanism. So am I going to focus my energy there? And if we just talk, we may stay with that for a while. Or we recognize that as somebody truly in pain. And see, with the multisensory approach, we go after the pain. We go to heal the pain, not just talk about the defense mechanism.
We talked earlier about one of the tool of the whole idea of the rear view mirror. Mm-hmm. Any client that's trying to get in recovery, but all they're doing is looking in the rear view mirror and saying things like, why is the windshield?
Yeah, the windshield. Why is the windshield this big and the rear view mirror is that big?
Yeah.
And it gets clients to think, and it's not that your past doesn't have a purpose. That goes back to validating, because many people have shame with addictions. That's why they anesthetize. So we validate whatever it is they experienced in their past, but then we get them to put it in perspective. Oh, the windshield's this big, the rear view mirror's this big.
Show us a couple more of those.
Another thing that we do, we know that our clients go through this if they go through the 12-step process, doing their inventories. We sift through.
Show what that is.
This is just a sand sifter. Okay, you use in a sandbox, and I tell them, whether it's a group or an individual, your dirt is welcome here. We're going to sift through your dirt. It's welcome here. Again, validating.
Wow.
We're going to sift through, because without the dirt, nothing can grow. Mm-hmm. So please bring your dirt here, and that's what we'll do. We'll sift through it. Mm-hmm. Yeah, and that's, so just knowing people, again, shame, guilt, remorse, or resistance. So we want to let people know that we're not going to judge. We're going to validate what they've experienced, but then we're going to work on moving forward. Yeah. This is one that I also, for psychoeducation, because a lot of addictions is not therapy, it's psychoeducation. I do a lot of trainings in school systems, in higher education, in communities. And so you want to engage, you want to have fun. Not everybody knows the consequence of addiction. And I talk about the power this has over us, whether we're addicted or not. And so I appeal to the younger population, saying this way. I say, you can go out, you're partying one night, you think that you're talking to her, and you're picking her up, and you think you took her home, but you wake up next to her. You see, and that always, the crowd laughs, they get engaged, they relate, but it just shows how alcohol, when you're impaired, you'll make different decisions. Yeah. So it's not just about everybody being addicted, it's about that process into addiction.
Well, let's close this out just by talking a little bit more, because what we're trying to sell you on, anybody that's watching, is the idea of that it's okay to be creative.
Yes.
And it makes because addictions work is hard
It's
work.
hard work.
And it's not I want to say it's not as rewarding. It can be, but you have a lot of clients that don't.
Well, only
Don't
one
make
third
it.
of the people make
Yeah.
it. Only 1/3 of the people. So you give everybody all you've got, but going in, only 1/3 are going to make it for other factors that have nothing to do with us. So we want to, by giving them all we've got, we want to offer them as many opportunities they have to heal, to get well.
Yeah, free yourself up to be creative.
Yeah.
I mean, and to get out of your seat, use a whiteboard. I think the small chair, anybody, anybody that's doing counseling.
I have clients come back to me every week, or group members, and say, I was in that chair all week long.
It's the most powerful thing, the whiteboard and the small
chair. Absolutely.
Yeah.
And it also, in addictions counseling, because the statistics are so low in how people get well, it helps me, I can say, enjoy what it is I'm doing.
Yeah, and I know you've had this and I've had it. They said that this has almost helped me to not be burned out.
Yes.
And it's not that we're advocating a burnout workshop, but that's
what happens
Yeah.
when you run out of things to do, when you're ineffective. And so this makes me more effective as a counselor.
and people get frustrated because the addiction people, they relapse or something.
And they take that personally.
Yeah, right.
And they feel, well, what's the point? And that's what the
And
counselors.
then they get mad at the client.
And then they start, and so they start
they
beating.
beat up.
They beat up on the clients. And so I know, using a multi-sensory approach, being creative, having courage. Okay, it's a win-win for both the clients and the counselors.
Yeah. I'm going to talk for just a second about this because it just got me thinking. One of the analogies that I use is in the United States. Friday night is high school football, Saturday is college, and Sunday is pros. Do you want to be a Sunday player? Some of you watching this maybe want to be a Sunday player. Then you have to be creative. You have to be theory driven. Hopefully you'll watch these YouTube clips on addiction. You'll watch the other ones on impact therapy. And for more information about impact therapy, go to impacttherapy.com. You can also go to, you want to tell them how they get a hold of you?
My website is what'syourecho.org, what'syourecho.org, and then you can access me if you want additional trainings, or if you have any other information, ideas that we can offer to you. You can send us an email, let us know what your circumstances are, and we'll be willing to help you through it, or we're willing to come and present workshops for you or your agencies.
Say that again. What's your echo?
What's your echo?
All one word.
Yes, .org, all one word, what'syourecho.org.
Okay.